The next paper and abstracts have been submitted by colleague Rybakova and co-authors Peculiarities of Suicidal Behavior in Men and Women. Overall, topic of suicide research is very actual, and Lithuania is still keeping one of the highest rate of completed suicide in the world for the last decade. And it is important to try to look for all the possible risk factors which are related to suicidal behaviors in such a way, trying to figure out what would be the most efficient means of preventing suicides. And the studies of patients who have been admitted after suicide attempt to the healthcare institutions, it's an important topic. Although quite a lot of studies have been done on this topic and presented and looked on these basic rates. What would be in such a case, although you looked in a group of patients who have been, hopefully it's not clear stated in methodology, all consecutive patients admitted over the certain period of time, it would be good if you would state it clearly in methodology how this sample have been assessed and that it is a representative sample of Kaunas clinic, meaning trying to get at least in a certain period of time all possible cases who have been admitted with suicide attempt. This would make the sample more representative. What else in methodology parts is missing because many factors are interrelated, or some of the factors are co-founding each other. The more sophisticated statistical analysis, like logistic regressions of different type, would be more would make the study more scientifically valid and all the conclusions. The same also applies to the way how results are being present in abstract form. There's a lot of percentages of description where it sometimes is better present in the form of table if you will consider making as a poster. And what we are missing and lacking is this more advanced statistical analysis of the data, which would give us a clear picture, more strong evidence on possible risk factors. Overall, abstract is well written in a way of language and how it's pretty easy to comprehend. Regarding ethical aspects, this is a pretty sensitive issue, and this depends what was your possibilities to be in contact and collect this data, either by evaluating the patients or just using medical records. If you would go for evaluation of each of particular patients, you might get even more sensitive data, and for this definitely all the key elements of ethical questions have been addressed, and also trying to provide some specific care for these patients, and bearing in mind that they are presenting a high risk group for completed suicides. But otherwise, your colleagues have been working hard, collected a decent number of patients. The only some improvements in methodology part would make this paper even better than it is at the current form. Thank you.